Dr. Collins here. I just wanted to take a minute and talk about Lynda's story. Many of you have been watching that recently, and we talked about how she was experiencing a lot of neck pain, but also low back pain as a result of prior traumas. And I wanted to, for a moment, just kind of explain how, when the atlas vertebra goes out of alignment, it can cause a lot of those kinds of discomforts and why. So I brought a model with me. It's what I typically show patients to talk about this area. You've got the skull, atlas, and then cervical spine below. You're going to have the nerve roots that are feeding out of the spine, the blood flow that's running through the spine up into the brainstem and skull. Discs, you'll see these guys right here, these discs. Vertebra, right? These are the structures that can feed a lot of pain. What you won't see here are the muscles that would be wrapping around the spine, and a lot of you are experiencing tension and discomfort. So when we're talking about the atlas vertebra and how it misaligns, that's up top here. You're going to see the brainstem running through the spine in this area. It's a very critical area for your health, all right? When the atlas displaces, what are we talking about? That's going to be misalignment at the base of the skull like that. And you can even see visibly how that can put pressure on nerve roots. It's not a stretch to assume that that might not be ideal for somebody's health, right? So let's talk about what Lynda was experiencing. When you have the muscles that are pulling asymmetrically because the head and the neck are not properly lined up, that can create a lot of tension, trigger points, discomfort in the neck muscles that are attaching into the lower neck and shoulders. That's one thing. Two, when the head and neck are out of position over some time, your head is like a bowling ball. I'm talking 10 to 12 pounds. Having that weight not properly distributed on top of these vertebrae can create a lot of tension and inflammation that ends up building up and putting pressure on the nerve roots as they exit the spine. That's not so fun, as that can radiate down even into the arm for some people. From a blood flow standpoint, so if you remember Lynda referenced brain fog, this is a big one in here that you'll hear with people. These arteries that feed the brain are having to actually run through the atlas vertebra as they move up into the skull. So as you start to have rotation in these joints, you can even have blood flow that can potentially be affected, right? Things like high blood pressure, vertigo, these kind of things. Over time, when you've been out of alignment for a while and you've had whiplash, structurally, you'll see the vertebra, right, start to do lipping and spurring. Arthritis is what you'll hear a lot of. And the discs can decrease in their height. You can lose a disc height as well. So those are some of the changes that can take place. That will always come with inflammation that's in the spine that can also really irritate these nerve roots, which is no fun either. So I hope that helps a little bit understanding why having that atlas out of alignment can really affect you from a physical standpoint with the muscles and the nerve roots. Listen, I'm doing this and I'm sharing this with you because I know there's a lot of you that are out there that are experiencing at least that tension at the base of the skull, tightness in the lower neck and everything, tightness in the low back. You guys, I'm sure if you check your neck out and you kind of explore in there, you know that it's tight. The base of the skull just feels off, would be a good way to say it. Putting a little bit of pressure on that nerve root on that right side can either kind of relieve things or even cause it to radiate because you know it's a little bit off. Listen, if you have never had your neck checked, if this is all new to you with upper cervical care, I'm talking to you, I would love to hear from you. So message us, get in contact with us. We have a monthly workshop that we do. It's a dinner workshop, dinner with the doc. I would love to hear from you guys and see you there. We basically talk about this kind of care and who it can help and how it has the capacity to really change your life. You do not necessarily have to live with a life of drugs and surgery forever. There are other options. So that's why I'm doing this. I wanted to reach out and talk to you. So thank you for watching this. I hope you learned something. I look forward to hearing from you guys. God bless.